The Society of Gastroenterology Nurses and Associates, Incorporated, presents this offering in our ongoing pursuit to educate healthcare providers working in all settings where gastrointestinal endoscopy is practiced. This presentation illustrates the steps that are critical to ensure safe and effective care for the public that we serve. Since contaminated endoscopes are potential sources of infection for both patients and personnel, Sgna recognizes that strict guidelines are needed to standardize the cleaning and disinfection of flexible gastrointestinal endoscopes. This DVD presents Sgna's standard of infection control in the reprocessing of flexible gastrointestinal endoscopes. Companion documents include the Sgna guideline for the use of high-level disinfectants and sterilants, and Sgna's cleaning chart. This DVD can be used by institutions and endoscopy centers as a convenient tool for training and competency validation of department personnel. It is intended to be used as a supplement to product manufacturers' guidelines, federal regulatory agency standards, and institutional policies and procedures. After viewing this, the gastroenterology nurse and associate will be able to 1. Identify the internal and external components of the flexible GI endoscopes. 2. Describe the procedure and rationale for each step of reprocessing. 3. Perform the cleaning and disinfection of the endoscope following Sgna recommended guidelines. 4. Demonstrate competency in proper endoscope cleaning and disinfection. Flexible endoscopes normally only come in contact with mucous membranes and are therefore considered semi-critical medical devices, according to the Centers for Disease Control classification. Critical invades the blood barrier, semi-critical contacts mucous membranes, and non-critical contacts intact skin. To prevent the spread of microorganisms during endoscopy, semi-critical instruments must receive scrupulous mechanical cleaning, followed by high-level disinfection immediately after use. High-level disinfection is a process that results in the destruction of all vegetative bacteria, viruses, fungi, mycobacteria, and some, but not all, bacterial spores. High-level disinfection is recognized as the standard for reprocessing flexible GI endoscopes by several major professional organizations, including the Sgna, APEC, AORN, ASGE, AGA, and ACG. High-level disinfection, recognized standard for reprocessing flexible GI endoscopes. Only chemical germicides cleared by the FDA as high-level disinfectants and sterilants should be used for high-level disinfection. For example, a glutaraldehyde, peracetic acid, and orthophthaledehyde. Because the FDA protocol for approval of chemical germicides does not include pre-cleaning as part of the testing, times and temperatures may vary. By the nature of their design features, endoscopes are more difficult to reprocess than other medical instruments. A basic understanding of the internal workings of an endoscope will assist the user to properly inspect, use, clean, and disinfect these instruments. Endoscopes have long, narrow channels that make cleaning and inspection for cleanliness difficult. The suction or biopsy channel, air channel, and water channel traverse the length of the endoscope, including the insertion tube and light guide tube and umbilicus. Use a cleaning brush for all channels that are accessible. Purge all other channels such as air or water channels. Some scopes have special feature channels such as elevator wire and auxiliary water channels that must be accessed during reprocessing. Refer to the endoscope manufacturer's instructions for information specific to each brand and model of endoscope. Several brands will be used in this presentation to illustrate special features. Several steps are required to properly reprocess a flexible GI endoscope and render it patient-ready. The steps are 1. Pre-cleaning. 2. Leakage testing. 3. Cleaning with endoscopic detergent solution. 4. Rinsing. 5. High-level disinfection. 6. Rinsing. 7. Drying and alcohol flush. 8. Storage. Be sure to follow OSHA guidelines and regulations and standard precautions when handling contaminated endoscopes. Gowns, face masks or shields, gloves, and protective eyewear should be worn during reprocessing of endoscopes. 1. Pre-cleaning. Pre-cleaning is the first important step in reprocessing an endoscope and should occur immediately following the procedure and while the light source is still attached. Perform the following for pre-cleaning. Wipe all debris from the exterior of the endoscope with an endoscopic detergent solution. The detergent should be FDA approved, made specifically for this purpose, and not a household detergent. Suction detergent solution through the scope until solution is visibly clear. Alternate suctioning air and solution several times. Finish by suctioning air. Suction air and clear air water channel free of fluid. For 2-channel endoscopes, aspirate detergent through both channels. Clear the air and water channels according to the scope's manufacturer's instructions. Flush the auxiliary water channel even if it wasn't used. Disconnect the scope from the light source. Place it in an enclosed container and transport it to the reprocessing room. Attach any necessary water-resistant caps to the electrical connector. 2. Leak testing. Leak testing should be performed after each use of the endoscope. A leak in the external or internal compartments of the scope will compromise the integrity of the watertight design. This creates a potential for contamination or damage to the instrument. Perform leak testing according to the manufacturer's instructions. Note that both manual and computerized leak testers are available. Attach the leak tester and pressurize the scope before submersing in water. Verify pressurization of the scope, either visibly or by touch. Visually inspect the entire endoscope for gross damage. Detach all removable parts from the endoscope. With the entire scope submersed, inspect the entire length of the scope for evidence of a leak. Pay particular attention to the bending section of the insertion tube while deflecting the distal tip in all directions. Observe for bubbles coming from control knobs, the insertion tube, and the openings of the internal channel at the distal tip, the valve ports, and the connectors. If a leak is not detected, remove the scope from the water and depressurize the scope. If a leak is detected, follow manufacturer's instructions for decontamination to avoid further damage. 3. Cleaning with endoscopic detergent solution. Manual cleaning is the most important step in any reprocessing protocol. Unless thorough cleaning takes place, no chemical germicide will be effective. Automated endoscope reprocessors are not generally designed to replace manual cleaning, although new technologies have recently emerged that make this claim. Measure solution as appropriate and according to manufacturer's instructions. Soak the endoscope and all removable parts in the detergent solution. Clean all removable parts with brushes and applicators to remove debris. When practical, make an effort to keep the scope and all removable parts submersed while cleaning. Thoroughly clean exterior of scope by brushing and wiping until all debris is removed. In order to prevent damage, do not place any other accessory in the sink or container with the endoscope during reprocessing. Clean the inside suction valve, the air-water valve, and the biopsy port openings. Brush the entire section biopsy channel system. Pass the brush through the biopsy port in the direction of the insertion tube and observe it exiting the distal tip. Be sure to brush the channel between the suction valve and the biopsy port, then pass the brush in the direction of the umbilicus until it emerges from the suction connector. Clean the bristles of the brush each time it exits the distal tip and the umbilicus. Repeat brushing until no debris is visible on the brush. When cleaning the ERCP scope, be sure to deflect and clean behind and around the elevator. Attach cleaning adapters to the endoscope and cover the biopsy port. With the scope immersed, fill the channel with detergent solution and soak for the time specified by detergent manufacturers, usually 2 to 5 minutes, but only if using enzyme detergents. Flush solution through all channels of the scope until no visible materials remain. Channels that should be accessed are suction biopsy, air, water, elevator wire, and auxiliary water channels. Because of its small size, a small caliber syringe, 3 to 5 cc, is needed to access the elevator wire channel. 4. Rinsing. After cleaning, the scope should be thoroughly rinsed to remove residual detergent solution. Rinse the endoscope and removable parts thoroughly in clean water. Flush all channels with water to remove debris and detergent. Purge all channels with air. Wipe the exterior dry to prevent dilution of chemical disinfectant. 5. High-level disinfection. High-level disinfection is the acceptable standard for reprocessing GI endoscopes. Prepare the disinfectant in accordance with the label instructions, taking precautions to avoid exposure to harmful vapors. If disinfectant is reused, it should be tested regularly, according to the manufacturer's instructions and your institution's protocol, to ensure the minimum effective concentration, MEC, of active ingredients. Use product-specific test strips. Reusable HLD sterilants must be changed whenever the MEC fails or the reuse life expires, whichever comes first. For manual disinfection, immerse the cleaned, rinsed, and purged endoscope in a high-level disinfectant. Fill all channels with disinfectant until no bubbles are seen exiting the opposite end of each channel. Make sure that all channels are accessed. Place all valves and other removable parts in the disinfectant. Cover the disinfectant in a soaking basin with a tight-fitting lid to minimize exposure to the chemical vapors. Use a timer to ensure that you have adequate soaking time for the chemical you are using. The 2003 Multi-Society Guideline for Reprocessing of Flexible Gastrointestinal Endoscopes is a position statement which speaks to the process and issues related to the reprocessing of flexible gastrointestinal endoscopes. With this, the issue of exposure times and temperatures of FDA-cleared high-level disinfectants and sterilants are discussed. The Multi-Society Guideline reports that multiple scientific studies and professional organizations support the efficacy of greater than 2% glutaraldehyde at 20 minutes at 20 degrees Celsius. For other solutions, consult the manufacturer's label instructions. The ASGE and Sgna convened a conference at which the Multi-Society Guideline was created. The document is endorsed by organizations such as Sgna, AGA, APIC, JCO, ACG, ASCRS, AORN, SAGES, and FASA. It is important to keep abreast of all current research in regards to the reprocessing of flexible gastrointestinal endoscopes. In addition to the Sgna, organizations such as the CDC, ASGE, and AORN have infection control standards that speak to this important topic as well. When the soak is completed, purge all channels with air to remove disinfectant. If an AER is used, consult the manufacturer's guidelines for the procedure to connect the endoscope to the reprocessor. Follow all steps for the mechanical cleaning and rinsing of the endoscope prior to disinfection. Carefully insert the endoscope into the reprocessor. Place valves and other removable parts in the reprocessor in special containers, if appropriate. In order to prevent damage to the scope, do not place any other accessories in the reprocessor. Attach all channel connectors. As noted in the 1999 FDA-CDC Public Health Advisory, any conflicting recommendations between the reprocessing manufacturers and the endoscope manufacturers must be resolved, particularly when they involve the use of channel connections or the capping or non-capping of specific lumens or channels. The elevator wire channel of the ERCP scope should be accessed manually unless validated by the endoscope reprocessor manufacturer. Be sure to follow label instructions for the preparation and use of detergents and high-level disinfectant used in a reprocessor. Set the reprocessor for the time appropriate for the chemical being used. Start the machine and allow it to complete all cycles and phases. 6. Rinsing. The endoscope should again be thoroughly rinsed to remove disinfectant solution from all surfaces and the interior channels. Residual disinfectant can be harmful to the patient's delicate mucosa. Thoroughly rinse the exterior of the endoscope with large amounts of clean water. Use fresh water for each rinse. OPA requires 3 rinses. Thoroughly rinse all channels with large amounts of clean water by flushing with the channel adapter. Thoroughly rinse all valves and detachable parts of the endoscope. If AER is used, ensure that rinsing cycles have been validated for the high level of disinfectant used. 7. Drying and alcohol flush. The endoscope should be dried with forced air to complete reprocessing. Purge all channels with air. Air may be provided by a central air source, a pump or compressor, or canned air. Avoid excessively high pressure. 70% isopropyl alcohol is used to assist drying the interior channel surfaces. An alcohol flush should be used even if sterile water is used for rinsing. Flush all channels, including accessory channels, with alcohol until the alcohol can be seen exiting the opposite end of each channel. Regardless of the AER, the ERCP channel should be flushed with alcohol and manually dried. After the alcohol rinse, again purge all channels with air until dry. Air may be provided by a central air source, a pump or compressor, or canned air. Avoid excessively high pressure. Remove the cleaning adapters and devices. Dry the exterior of the scope with a soft, clean, lint-free towel. Dry all removable parts. 8. Storage. The patient-ready scope should be stored where it cannot be contaminated prior to its next use. Hang the endoscope vertically in a clean, well-ventilated, dust-free area. Do not store scopes in their carrying cases. Do not attach removable parts to the endoscope prior to storage. Now, let's review the steps for endoscopic reprocessing. 1. Pre-cleaning. 2. Leak testing. 3. Cleaning with endoscopic detergent solution. 4. Rinsing. 5. High-level disinfecting. 6. Rinsing. 7. Drying and alcohol flushing. And 8. Storage.